It's up.
It's up. All right. Thank you so much. All right. So welcome everybody to this particular virtual training session. I think you've all received the syllabus for the training. You're going to be receiving login credentials to the learning management system, and I'll give you a preview of how that looks like. We got the accounts created, so I will be showing you a preview of that. But I wanted to introduce this particular training session for you to understand. So as I said, my name is Dr. Victoria Mukami. I am a lecturer and researcher at the University of Embu. I also work one of the directors at Innovate AI Health Lab, which is an NGO also in Kenya that does a bit of AI and mainly in a lot of health situations. So just to start us off, the objectives of this particular training, so not the objectives of my slides, but the objectives of this particular training. We are going to be doing training over the next 3 weeks. So we need to know, why are we doing this training? What's it going to be all about? So the first thing is, we are going to be trying to have you understand what machine learning and federated learning is. If you note, you've all joined as team members. We might have a couple of the secretaries that has joined, but the rest of you are all in teams, and these teams are made up of computer scientists, computer engineers, software developers, data scientists, statisticians. We've got radiographers, nurses, doctors. So this is mainly meant not to be about coding and not necessarily about how you can create a model, but more of it for you to understand what the techniques are and how to use these particular techniques. So that's the first thing, understanding ML and FL techniques. The second is going to be applying. So when we understand machine learning and federated learning techniques, then you're going to be applying ethical and inclusive AI. So you'll note some of the topics that we're going to be looking at is, how do we deal with real data in applying these machine learning and federated learning techniques. After that, we will be looking at ultrasound data and how to analyze ultrasound data. And I will explain where our ultrasound data comes in the next couple of slides. And then after that, as teams, we will collaborate and develop some prototypes. So this is to be done within 3 weeks. And of course, this virtual training is what will lead to the hackathon. The hackathon basically will be held in person for selected teams that go through this training and actually succeed. So the prototypes essentially might be a bit of it during this training, but majorly the prototypes will be done during the hackathon. Why this particular project? So first thing I want you to conceptualize is this. So this is a diagram I got online. I'm not really going to be able to make my own map, but I got this diagram, and we talk a lot about the global north and the global south divide. So what is exactly the global north, global south divide? It's like saying high income countries, low and middle income countries, but in a different way. So you'll note, as far as you're saying global north and global south, Australia is somewhere right towards the south end. So when we talk about the global north, global south, and it might come up during this training session a lot, I want you to think about the low middle income countries or the low income countries, and you'll see it's like an imaginary line splits them, so that you've got South America, you've got Africa, you've got South Asia, forming parts of the global South. So when we look at it, a lot of problems are occurring, and health-related problems occur within the global South. And our project basically focuses on that. And so we've been collecting data from countries within the global South. We have representation here from where I'm from, Kenya. We've got Uganda, we've got Nigeria, we've got Pakistan, and we've got Nepal. And these countries all fall within the red part, just in case it's not so clear. Now, based off of this map, I'd like to show you another map for you to understand why does this training matter. So conceptualize the previous map where we had the global south basically forming these countries. This might not actually be part of the global south, but just conceptualize that. And then take a look at these colors that we have. The darker the color, the worse it is, the worse it is for those countries. And this map basically is of the maternal mortality rates. And this is figures that they've projected or had projected for 2025. You might get lower rates for the different countries. And just by looking at this, you'll note Sub-Saharan Africa, which is this, has deeper colors. And you'll see, according to this legend, I know the legend is a bit small, but then you'll note the dark blue goes for 1200, while the yellow actually goes for 0. So Sub-Sahara is mainly dealing with 600, 400, 600, 800, 1000, 1200. For South Asia or Southeast Asia, also you've got countries like Afghanistan here that has got a bit of a darker color. And if I just look at the rates from that I was trying to see as I was preparing these slides, this is Chad, and Chad I think has got really high maternal mortality. No, this is not Chad, sorry. This is South Sudan, this is Chad, this is Nigeria. So Chad has got, South Sudan has got very high maternal mortality rates at 1,223 per 100,000 women. So if I was to look at it, basically, for every, and 100,000 to conceptualize that might be a bit hard, but for every 100 women, one or more women die from pregnancy-related complications. Now, Nigeria is also a bit high, basically at 1047, it's a bit lower than Sudan. So for every 100 women, one person basically is passing from maternally related complications. We've got, and I'm just trying to go through the countries that are represented here. We've got Kenya that has got about 530, which is for every 200 women, there's a woman who is dying. Uganda is a bit lower at 284, Nepal at 174, Pakistan at 154. But then you realize pregnancy is meant to be a period that's meant to be safe. It's meant to be a period where women are not meant to die from complications, especially those that can be seen in advance and sorted in advance. And so this is why this training matters. Not just because in Sub-Saharan Africa we are having issues, but because even in the other countries, the rates are still unacceptably high. You're basically meant to have rates that are below 50 or no rates at all, right? So this is why the training matters. And so it gives us 4 main things. The need, we have got a lot of persistent maternal health issues and health challenges. And these are basically compounded from issues like a mother did not get an ultrasound scan, so they did not see that she had issues in her pregnancy. And then she never went to clinic. She went during the 3rd trimester when she noticed there was a problem. And by the time she's going in the 3rd trimester, when they see the problem, it's too late and she passes on. Of course, the child dies as well. So there's persistent challenges within the global south. There's a lot of barriers. Where we are doing this study, where we are collecting ultrasound data, there is a clinician there who was telling me that there are women, he's from a remote part in Kenya, and he was telling me if a woman wants to go to hospital for a scan, they have to do a 1-hour drive on road that is not tarmacked or paved. You can imagine a 1-hour drive to try and get to the nearest facility. If the woman woke up with bleeding or a woman woke up with problems, by the time they're getting to the health facility, it's either they're not going to be able to save the woman or save the child. So there is an issue of resources. With the nearest health facilities that can be able to deal with major problems is an hour away, that's a problem. And that's just not in Kenya. You'll find the same happening in different countries. We've got competing health priorities and just competing priorities where you find there's more need for other facilities. And so maybe maternal health is not prioritized. If I was to look at the case of maternal health before COVID, maternal health was a high priority. When COVID came, it was put on the back end because it's not really an emergency. COVID was more of an emergency. And then you find there's more and more issues in a country that has different types of pandemic, a country that might have Ebola, for instance. They're not going to prioritize maternal health. They might end up prioritizing for issues like Ebola and the likes. So those are just some of the barriers that cause us not to have good health outcomes. Then we have the opportunity, which is what you have at this moment, where we are trying to see whether this training can help create some impact. And so we look at it as getting AI models, we get local data, train this model together with what we call a portable probe or a portable ultrasound device, and we are able to provide local affordable maternal care solutions so that even the dispensary right next in the village can actually be able to do the ultrasound scan. And of course, we'll have high impact where we reduce those rates we've seen in the previous slide. We'll have clinicians who are empowered, where we've got nurses or midwives being able to do the ultrasound. And of course, you as innovators can be able to do more sustainable solutions. So this is just one of the projects that is being done on maternal health, but then there's a lot more being done, and you're just being involved in this specific one. So with this training, we do have a specific structure. Just having seen what the need is, we have a specific structure. And our structure basically looks at week 1, where we'll be doing a bit of machine learning and an introduction to imaging. We will have some topics around that. The second week, we will be having federated learning being taught. And I will introduce these instructors in a bit. They're not in this session. You will meet them as we continue on. However, when we get into the demonstration of the learning management system, I'll be able to show you that. And then during the 3rd week, we'll have the clinical context and actually start working on the ultrasound data. So 3 weeks of intense learning. You'll need to do some labs after each week's session that you will need to submit and will be reviewed. Our timing, according to the timetable you saw, that is about 1.5 to 2 hours per session. So like today's will be 2 hours just because of the introduction. And mainly our format will be these live lectures we have, some LMS resources, some team projects, and some labs. Expectations and engagement. Of course, we expect a lot of active participation. We do expect questions to be asked. You can ask those within the chat. We will have myself or the secretariat within the classes just to make sure that questions are taken care of and answered. In the event that the class ends before they can be answered, we will pass those to the specific trainer. We will create, and with the learning management system, there'll be some forums. So some of the questions that will be asked will be posted within the learning management system so that everybody can be able to see those. Some discussions within the LMS. And then, of course, lab work is expected outside of the sessions based on the work that will be given. We do expect some team collaborations across countries. This is not going to be your normal virtual training where there's some forums and you respond and then somebody else responds to your forum. We are trying to change that a bit where you could try to find out different things about the different countries. So By Thursday, there are some activities that will be up under week 1. And those activities, basically, some might require you to reach out to other countries just for some collaboration of sorts. And then certificates will be given upon completion of this. These certificates will be for the teams. So like I said, we have a couple of the secretariat who joined this particular session, but then certificates will be for those teams that were selected to do the training. So some housekeeping. Kindly let's keep time. We will be starting at the top of the hour. Today we gave a 5-minute buffer just so that people could join. The meeting will be open 5 minutes before. Today, I think there are people who are able even to join 10 minutes before. Because you're registered, you're able to join. You don't have to wait for the meeting to be started. We expect attendance of all classes, but then there will be a percentage, and this will be shared directly with, will be shared what we expect. We'll share what we expect basically for the attendance. I think this was within the syllabus. I can just confirm that. But I believe it was 80% of the classes. I will confirm that as the other facilitators go through the class. All sessions will be recorded. We will share this recording within the LMS system. So we will share a link to the recording. And then for etiquette, please mute your mic. If you need to talk, either raise your hand or go ahead and use the chat. Please rename your handle. Don't just have user1 or user2 or user3. I will request now, because you're doing some housekeeping, just use the chat to go ahead and message everyone, introduce yourself, perhaps just your name. You can use both names, what organization you're with, and the country. That will be good for you to do that within the chat. All right, so let me go ahead and do an introduction to the learning management system. So we'll just stop sharing this so that I can share the learning management system. Like I said, your accounts have been created. I'm going to be sharing those, how you're going to be logging in. Kindly note only that selected teams will actually have accounts, so I'll tell you the format in which to use for you to log in. Once you log in, you'll need to change your password. I can just stop sharing this. Let me just open the learning management system. So I'm putting the link to the learning management system on the chat. It is the University of Embu Learning Management System. So I just type that into the chat. Let me just share that screen. I hope you can see my screen. Kindly let me know. I think I can still see the chat. So in case you can see.
Yes, we can see.
Oh, thank you. Thank you. All right. So this is how the learning management system looks like. When you log in, when you get in, you'll put in your username and password. This is just one of the users. I was just putting in just so that you can see how it will look like. I will explain what your username and password will be, and then you log in. When you log in, it will request you to put in your password. It will ask you to put in the old password, a new password, and confirm the password. So I'd already logged in, so I don't want to do this because it means I have to change. I logged in as one of your accounts so that you can see it from your side. So when you change your password, this is what you'll see. And I think I'm logged in as, let me see. The name is believe it was Mohammed Nuruddin. So I logged in as you. So I'll tell you what your password will be. But I had to use one account so that you can see how it looks like. So this is the University of Embu Learning e-learning portal. I couldn't use my account because I'm a faculty member. My account looks different and I have so many courses under my account. So this is what you'll see as students. So you'll see home, dashboard, my courses, and Odell. In our case, you'll see the one course that you're registered for. Unfortunately, because you are a cohort and you're not students of the university, this is the only course you will see. So for now, you'll click on that course. It says that I am the teacher, but that's just because I'm the one who is dealing with setting it up. So you'll open the course and there's different activities. Some of them are hidden. Like you can see here on the left, we have week 1 and the different days. We've got week 2, and the week 2 has got the different days, but then these days have not yet been shown. They'll become active at the end of the week, and then we have week 3 and the different days. And so if I just close that side, you can be able to see the course. This is just the course overview. It basically shows you what the course is all about, the duration. I'm going to be putting the link here just in case. However, for your registration email, if you check on whatever account you use, and if it was specifically Gmail, you should be able to save that to your calendar so that you just get that directly. But I will be putting something in here for you to be able to get the link. It's the same link for all the classes. The timing is a bit different. So currently it's 5:30 here. I'm meant to be winding up so that we can have the first session starting so that we finish in the next 1.5 hours. The syllabus is here. You should be able to see that. So if I just click on it, this is the syllabus. Like I said, all the content is here. There were some changes to the federated learning, mainly because this team wanted to show you a bit of tutorials. So they changed so that they have some tutorials on federated biological kind of med tutorials. So you have all of that in there and what each session is. We just go back. We've got the overview of the course. So this course is made possible because the 3 of us applied for a grant to do some virtual training and some capacity building. You will be meeting Professor Ross on Thursday, if I'm not wrong, but she is a senior scientist at IDI. She also works at Queen's University Belfast as a professor. There's myself. I already did some introduction of myself. And then there's Dr. Bisesh, who is the director at NAMI and a research scientist. So we are the leads. And the projects that we've been working on, we also have a collaborator, Dr. Ochua, whom I'm not sure that you'll be able to meet, but she's from the University of Lagos, Nigeria. And we've got one more individual who is also a collaborator within this particular project. Now, on the other hand, this project is utilizing data that we are collecting for a different project. And this project basically is in 5 countries. We've got 5 different country PIs and one overall PI, that is Dr. Bisesh, for that particular one that will be giving us the obstetric ultrasound data that we need. So you'll be able to look at this. My introduction and welcome note is here. I will be putting also, I'll be adding different links as well. And then we have the week 1 that is to be conducted within today, tomorrow, and the day after. We've got the 5 facilitators. So today we will have Dr. Martin and Henry doing some presentation. And then tomorrow we'll have Nisant and Henry. And then on Thursday, I think we'll have Professor Ross and I believe Henry. I'm not sure. We'll confirm that. So we have the profiles of each of your instructors here. So you can read and see what the instructors have done previously. We have the learning outcomes, and then we've got what sessions are there for week 1. For this lab, this will be replaced with the activity that will be due, that will be due before the next class, but will be available from Thursday. So for day one, we have the introduction to machine learning in healthcare and computer vision in medical imaging. So the introduction is there's 2 different slides that are going to be done. And then there is computer vision that will also be done today by Dr. Martin and Henry. Tomorrow we have pre-processing. I believe this is just one person will be doing that, Nishant. And then the third day we've got 2 notes. I'll be uploading this later. Model training, evaluation, and bias, fairness, and regulation in medical AI. So that's the first week. Second week, we've got 3 instructors who will be taking us through federated learning. We've got Francesco, Lucy, and John. All 3 are scientists and researchers from INRIA in France. And basically, they're being led by Marco Lorenzi. He's the one who is reviewing what work they're doing. They're also setting up our federated learning environment. So we've got the learning outcomes and the sessions. The lab, again, will be posted within week 3. This is not yet available. The lab will be within week 2. These notes are not yet available. They'll be available at the end of the week or the beginning of the next. And then for the third week, we've got 3 facilitators. Dr. Pradeep, who is senior, he's an assistant professor in Nepal, as well as a senior radiologist. He does a lot of radio diagnosis. And he's going to be taking you through day 7 sessions and partly day 8. We've got Professor Ross again. And then we've got Sukrit, who is works in the Terras group that have been developing all the systems and the model for this particular project. So that's what you expect in the learning management system. For each day, we will be having some forums. So like today, you will find a forum here that just asks you to do a better introduction of yourself. And then after that, we will have forums that you can ask questions, you can peer answer each other, and the facilitators as well will be able to answer any that are emerging. All right, so that's it from my end. I will be sharing details on how to access your accounts. In the meantime, however, the best way for you to do this, your username is going to be, I'll be sending an email on this. Your username mainly is going to be your first name, last name. So I'm just putting this in the chat so that you can see it. So username is first name underscore last name. And if that doesn't work, try last name underscore first name. The reason might be that the way your name was presented, maybe the last name was under the first name and the other way around. That's your username. And then your password, and this is just for the teams that had been selected to get to the learning management system. Your password is going to be student with a capital S #123. So please check the chat. You can be trying it out in the meantime. But then I will be sending an email with this, just telling you how to join. And then if you have problems, you'll email me and I'll be able to respond. For Mohammed Nuruddin, I changed your password. So I will be communicating with you directly on if I see you on the chat, I'll do that and just tell you what your password is. All right, so thank you so much. I don't know whether there are any questions, any concerns. Perhaps just to save time, you could put these questions directly on the chat. I will be reviewing them, but I'd like to introduce our 2 instructors for today. Before they begin, I'd want them to say something, and then I will respond to the questions on the chat. So we do have 2 instructors. We have Dr. Martin Palaba. He will do, I want to say a 1 minute to at most 1.5 minute introduction. And then we have Henry. So Martin, just go on.
So Dr. Vicky for the introduction and to the team that has made this possible. And to all of you guys who have managed to take time to apply. We live in an era where technology and AI are very crucial, but as it is always with healthcare, it's always very challenging to adopt technology. In the context of the Global South, I think this presents an opportunity for us to leapfrog and utilize this opportunity for artificial intelligence to better and strengthen our healthcare systems. So I am Dr. Martin Balaba, and I work with the Academy for Health Innovations at the Infectious Diseases Institute. I will be giving a very brief introduction from a user and medical perspective on an introduction to machine learning in healthcare. And I hope we'll have a great time with you guys for the next 3 weeks, and hopefully to see most of you with us in Uganda for the physical hackathon. And just to remind you, we'll be hosting the second AI in Health conference here at Makerere University. So it will be good for you guys to also start, registering for that conference. Details will be shared later. But yeah, thank you for making time and taking part in this great initiative. Thank you so much.
Thank you, Martin. Thank you. We have Henry. Introduce yourself, and then I'll give you the sharing right.
All right. Good evening, everyone. I'm Henry Semakula, and I'm a data scientist at IDI, Infectious Disease Institute, and I'll be taking you through introduction to machine learning. We're running out of time, so there is a message that was shared in the chat. You need to register. Please go and register. Don't forget to register, because registration is part of the selection criteria for the physical hackathon. So back to you, Victoria.
Thank you. Thank you for that. So I'll pass it over back to Martin, who will be beginning this session. Oh, wait, we have Raymond. Raymond, I see you. Please introduce yourself. I hadn't seen you there.
Good afternoon.
Just go on. It's okay. We understand.
Apologies. My name is Kamsi Raymond. Communications officer here at IDI. I'm very happy to be a part of this group, and I'm eager to learn. I hope everyone is. So yeah, I've been reaching out to a number of people via email. So yeah, this is me. I hope to see you guys.
Thank you so much, Raymond. I think everybody here knows Raymond. Everybody has received some email from Raymond, so thank you for that. So over to you, Martin. I think you should be able to share your screen. Just try and tell me whether it allows
Let me
you.
see if it's possible. Let me try just a minute.
All
Just a minute.
We have one.
All right. Just to confirm that you can see my screen.
Yes, we can. Thank you.
All right. I will be very brief, but I'll give what I think should be a good introduction. I'm Dr. Martin Balaba, and I work closely with the team here. I am also a researcher in AI and healthcare, and we have a number of projects, of which the dataset that you'll be using for the hackathon is one of the projects that I support. So the concept of machine learning, I'm pretty much sure that is not new to most of you. But as I said, that healthcare takes a different tangent in terms of adopting technology. And in the era of emerging technologies, there are things that we really need to be very mindful of and appreciate the uniqueness that is healthcare. And so I will just give a brief run through. I really like to create a visual impression of what we want to go into for this particular session. I'll try to go through what machine learning is, and then the different applications and how we are using machine learning already in healthcare. And interestingly, even within our local setting, we have programs that are running with machine learning. It's just that we barely spotlight them, but this is a unique opportunity for us to appreciate what's going on, know the gaps, and then collectively address those particular gaps. And then obviously the challenges to adopting machine learning within our context, of which then we'll be able to understand what we can mitigate and how we can leverage our different, the opportunity that comes with the challenges. So if you notice, we have a group from Nepal. I love Nepal. It's a very beautiful country. I hope to visit very soon. So I'm sure for the team in Nepal, they know this particular area called Kachen. I just saw it online and I realized how remote it was. And so I imagine the midwife in this very remote area in Nepal, a pregnant woman arrives for her very first ultrasound scan. The clinic has an old portable ultrasound machine, but there is no radiologist to interpret the scan. So from a medical perspective, the midwife is wondering, is the baby growing normally? Are there any complications that she should identify quite early? And is there any sign that should prompt her to refer the client or the pregnant mother to the higher health facility? And this is the case across many scenarios in the global south. I have worked in the most remote places in Uganda. I don't think the case is different in Pakistan, Nigeria, or Kenya. So you have both the infrastructure challenges, geographical barriers, and then you have the human capacity to address the critical healthcare challenges. But in the context of maternal and sexual reproductive health, where we are holding two lives, it's very important that we keep both of them, and we should be able to create a nice experience for both. However, that's not the case. So in a case of this particular area in Nepal, you would wonder how a midwife who is, the only human resource in this very remote place would benefit from technology. And in the context of us addressing sexual and maternal reproductive health, we thought that the concept of machine learning can actually come in to address a bit of the gaps within our settings. So with Henry, you'll go into the depth of exactly what machine learning is, but just to say that it's a branch of AI which is related to systems that learn by using data, and it uses the input and output data to make predictions, unlike the traditional programming that uses input data to generate outputs and run specific tasks as per the written code. So I understand that our participants come from different fields that are very complementary. So for those who are into the depth of software engineering, you will understand that machine learning is not the ordinary programming, and its functions really differ at a higher performing efficiency than the ordinary programming. And so why is it that we are taking a keen interest in machine learning in healthcare? One, we have seen there is an explosion of healthcare data from healthcare resources, imaging, patient data that comes from either it's paper-based or digital. We have all these electronic medical record systems. Most of them are disaggregated. But again, despite that situation, you also know that there are advances in machine learning and transformers. Computational capacity has increased globally, and also the opportunities trickling down in the global south. And also this comes with, the societal and regulatory environment changing with respect to the former three aspects. And so this is why we need to understand from an industry and from a clinical perspective, how do we leverage machine learning and what are the factors pushing it? Because as technology advances, opportunities come. And so these are some of the reasons why we need to, be very mindful of machine learning in healthcare and why we're talking about it at this particular time. Along the way, you will discover that with respect to machine learning in healthcare, there's some principles in the next 3 weeks that you're going to be hearing. If you're not familiar with them, you learn about supervised learning, unsupervised learning, reinforcement learning. And just to briefly state that if you're going to speak about supervised learning, you're looking at the type of learning that requires training with labeled data. And if I'm speaking about labeled data from the perspective of healthcare data, if you open a patient file, you'll find certain aspects that actually are already annotated or labeled within the clinical setting. So you're going to look at maybe patients' names, their past medical history, what diseases they have. That kind of data is already labeled. And so if you're going to use an algorithm to, oops, I'm seeing an interference on the screen. Vic, is everything fine? Hello?
It should be okay. I'm wondering
Yes,
what happened. Somebody must have annotated.
Yeah.
Yeah.
Yeah, so if you're going to deploy an algorithm using this kind of data, you have to understand that you're using supervised learning. And what's the difference when you speak about unsupervised learning? So this one uses labeled data. It uses data that is not labeled. Say, like you're going to navigate data. It's like walking through a busy town without labeled streets. So you're going to discover maybe hidden gems within the city that you're going to maybe later annotate and create meaningful data out of that. So imagine you having this sea of patient data that is not labeled. So with that kind of data, you are not going to be able to use supervised learning. It's going to be unsupervised learning because you're discovering new patterns within data that is just a lack of data. It could be from different research projects and it's just a data dump, but it's very useful. When we speak about reinforcement learning, what do we mean? So with reinforcement learning, using an AI agent, call it an algorithm, receiving. So let me take the example to say that you are trying to refine the functions of this algorithm, and if it gets anything wrong or right, you reward it, or you caution it in case it's going to produce an output that might be detrimental to maybe patient care, right? So that kind of learning, of machine learning, is what we call reinforcement learning. So imagine if you have a cancer patient whose treatment is going to vary depending on the stage of the cancer and the status of their body on the day of presentation. So you need to optimize their treatment. If you're going to receive chemo today, you're going to look at so many parameters, right? Their blood count, their hydration status, any presenting complaints, past medical history, how they have reacted. And so you're going to have to, let's say, titrate, optimize their treatment and their chemo on that particular day. So for the algorithm to do that, it's going to take into perspective all the historical data such that it can continuously learn and at that point be able to refine and optimize the treatment. I want to take a very quick stop and just to ask, are we on the same page? Do we have any questions right now, or do we take the questions a little bit later? Anything in the chat, Vicky?
None so far.
None so far.
Yeah.
All right. Can I get a thumbs up if we should continue or take a pause? Hello?
Yeah, there's a lot of thumbs up. I don't know why you can't see them.
I can't see them anyway.
Yeah, they're there.
So, Henry will go into the details of machine learning algorithms and how they're applied in healthcare. This will make more sense to the non-technical people as we go on. But in machine learning for healthcare, we have different algorithms that we use. We have logistic regression, decision trees, random forest, and these have different applications in healthcare. So if you're going to talk about logistic regression, you're looking at it's binary classification. It's a yes or no, it's negative or positive. And when do we use this in healthcare and machine learning? So an outcome of a disease, is it going to be positive or negative, right? So you're trying to quantify which patient population will either respond positively or negatively, or will have a certain outcome, it being positive or negative, or a disease condition. So it's more of a binary dichotomy of outcomes. when you talk about decision trees, so again, so logistic regression is essential for binary classification, but for the aspect of decision trees, we're looking at not only just, negative or positive outcomes. We are taking into perspective maybe patient history, and we're looking at outcomes to do with patient treatment. We're looking at what is the best, what do I say? I'm trying to get a clinical case that can define this better. If you have a population of clients within your clinic and you're trying to understand who is most at risk of either developing hypertension, even when they're not diabetic. So you have a list of parameters that maybe predispose a client or might categorize the client as a high risk for a certain outcome at a given time. Let me give an example. In the HIV clinic, a few years ago, when we were transitioning clients from the former standard regimen of antiretroviral treatment, and we're now adopting dolutegravir, we realized that certain patients were getting diabetes, yet they were pre-diabetic. And those that were pre-diabetic were now getting into overt diabetic. And those who were quote unquote normal were getting what we call dysglycemia. So we wanted to understand the association of dolutegravir and dysglycemia, but also wanted to understand of the cohort of patients that we haven't yet transitioned to dolutegravir, who within that population is most likely to get any undesired outcomes. So we have a cohort of patients that we've been seeing for the last 20 years. And what we did, we were able to design an algorithm based on decision trees to be able to identify who was at most risk. The other algorithm that my colleague Henry will talk about is random forest, and this is determining patient outcomes, and also trying to identify variables or risk factors that have the most influence through feature importance analysis that we'll explain later. So I'll try to go through this because of time. You'll also learn about the support vector machines and then the neural networks, which I think are so common that will be also applicable for images and things like X-rays, MRIs, especially in the context of what we're going to be looking at for this particular training. So you'll see most of the neural networks, the CNNs and CRNNs. The correlation of medical data and the respective ML tasks, you see that if you're going to use electronic medical data like demographics, lab data, and vitals, we're trying to do what does that mean in terms of using ML tasks? What does that mean in terms of applying ML to do these tasks? You're doing disease classification, yes or no disease. If you're going into images, using regression and risk scores. If you're going to do things like signals, that is ECG, EEG, spirometry, auscultation, using segmentation, that is falls within segmentation. We're trying to find out maybe tumor boundaries so that you can annotate data correctly. If it's text, that is clinical notes and guidelines. You're looking at applying sequence models. And if it's genomics and multomics, you're looking at clustering and patient phenotyping. So briefly, for you to appreciate how to use machine learning in a real life environment within the clinic, you're going to have to define the problem. You're going to have to collect the data, pre-process that data, meaning cleaning it up. You're going to design the model as per the nature of the data that you have, as previously discussed. You're going to have to validate that model. you're going to deploy that model, and importantly, you're going to have to monitor that model, because if you're applying it and there are issues of bias and fairness, maybe safety, you really need to, and this is a continuous process. I should mention that. So overall, what's the impact of machine learning in healthcare? We're looking at enhancing diagnostic accuracy, improving personalized care and medicine, and then also on an operational perspective, operational efficiency and better patient care. And all this combined together is improving healthcare systems across the different pyramids that form healthcare systems. The future trends of machine learning in healthcare, these you'll read up later. We have what we call tiny MLs for Internet of Things. This is like a distributed or smaller and more, there are smaller algorithms that can sit within either analog systems or a local system, and thereby you can run your algorithm and all your data processing within a smaller unit, meaning data can be safer. You can also use it within safe clinical settings without issues of internet latency, bandwidth, and then cost and data privacy. On the horizon, we have IBM doing quite a lot of quantum computing research, and so we believe that precision medicine and all this on the horizon will be possible, and where we'll be able to create quantum models that can deal with different aspects within the same time period. So you have a more versatile model that is running on quantum computing. Distributed ML portability, again, leverages the tiny ML. And then we believe that we can also decentralize MLs within the no-code environment, enabling those people or human resource that doesn't have what you guys have, the software engineers. So you might not need deep technical coding knowledge for you to be able to run an ML within your environment. And this is through the no-code environment. And finally, we have the convergence of machine learning and genomics. So here we're trying to analyze large amounts of genetic data. And here we'll be able to do the precision medicine, genetic markers for disease, and it will transform healthcare services as we know it and clinical practice. As always is, we know the challenges that we are facing within our environment, especially the global south. So you have issues of data. We barely have data. Data is very segmented. The quality also matters. And within the medical setting, you realize that data is unstructured. So it makes it a little bit hard for you to work with it. We have bias and fairness issues, interoperability and black boxing of models. So this limits your understanding of how a model works if it's just deployed without that community or expert participation. So you can't replicate it. And so it means, you're blinded. And that has been the case for most of the technology adoption in the global south, developed in the West, dumped in the south. The critical need to integrate MLs into existing clinical workflows, that's very critical. The ethics and regulations, safety and transparency, data privacy is still a very big issue. And then the shortage of experts, and we believe this is the essence of this training and why we wanted a multi-diverse team, so that we can extend the capacity and the training to a diverse people to address the issue of the shortage of machine learning experts and the legacy issues of connectivity and infrastructure within the global south. You look at this small exercise later, but I was just trying to create a small case scenarios and see what aspects of machine learning you'd be able to deploy for these different scenarios. So you can take a look at that later. So we all know that machine learning is transforming healthcare in all aspects. The success of this really requires collaboration. At the center of all this, we have to make sure that safety, ethics, and equity are very essential in all that we do. And it's this might be the only chance we have to improve our healthcare systems as the global south. And just to know that this is a process of just continuous learning. Everything to do with artificial intelligence is always changing every single week. So the attitude to always be able to learn and adopt new techniques is very critical. And everything else that you would like to learn, I've shared some resources from the Stanford AI Health, WHO, and then MIT Open Courses, where you find most of the things that I've talked about. I would like to end here and get some feedback before Henry comes in. Vicky, over to you.
Thank you so much, Martin. I think they have really enjoyed that. I'm seeing you're getting claps. I'm hoping you can actually see that. You might want to
I
stop
can't see it. It
sharing.
looks like everyone is quiet and bored, but I can't see it.
Yeah, stop sharing and then you'll see the claps. If you stop sharing and go back here, there, can you see the claps?
Okay.
There you
Okay, I
go.
was worried.
Yeah.
Thought I was speaking to myself.
No, you've not been speaking to yourself. All right, so thank you so much for that. I have not seen any questions so far within the chat, but I can see there's more, there's a couple more claps within the chat. So we will answer the questions as they come on. I think you are pretty clear on what it is that you are presenting. We do appreciate that. So we will have Henry finish up on the introduction to machine learning. Henry, I think you've already set up. And then for the scenario that Martin just shared, it's going to be within the learning management system. So you will see a discussion where you will discuss the two scenarios that come up. All right, Henry, over to you.
All right, thanks a lot, Victoria and Dr. Martin. So a good evening, everyone. I'm Henry Semapula, and I'll try to be a little bit fast, but feel free to raise questions as we go on. So a quick reminder is please register. Yeah. All right, so these are the learning objectives for this lecture. So by the end of this presentation, I expect people or participants to be able to define what is machine learning and its core components. At least we've seen some application of machine learning from Dr. Martin. I expect participants to be able to identify key ML techniques used, that is the machine learning techniques used, and to identify the benefits and challenges of AI. So I'll straight, okay. So before we embark on machine learning, we need to have a clear picture of what artificial intelligence is. So artificial intelligence, in simple terms, it's the umbrella, but by definition, it's a broader concept of training a machine to act or to carry out tasks in a smart way. So over years, we've seen AI being tested in the lab, but as years have passed, have gone on, we've seen now AI into our day-to-day lives, as we're going to see. So AI can be applied in medical devices like the project Dr. Vicky talked about, where they want to train a model that can be used by a non-technical person to carry out a scan, a standard of care scan. So it can be applied in smart homes as an example, but there is always an AI paradigm whereby people think AI is going to take over our jobs. To me, it's 50-50. It's debatable, depending on the angle that you see how AI is improving life. But I confirm to you that AI is here just to support, to improve how we're performing our tasks. So let's get a clear understanding of, we have a diagram. The bigger circle is artificial intelligence, like the way I said. Artificial intelligence is all about the techniques that enable a machine to mimic the human behavior in a smart way. And inside there, we have what we call machine learning. So machine learning is artificial intelligence. Machine learning is just a subset of artificial intelligence where you use statistical methods to enable a machine improve on the experience. Further inside there is what we call deep learning. Deep learning is also machine learning. Deep learning is just a subset of machine learning, whereby using neural networks to extract patterns from data, be it if you have medical data, you can use deep learning, maybe to train a model that can predict breast cancer, if you have breast cancer or cancer, depending on the type of cancer. So this is the big umbrella you need to understand when we talk about deep learning is artificial intelligence. When we say machine learning is artificial intelligence. There are other components inside there, like natural language processing, reasoning. There is also some logic in machine learning. So our major focus today is about machine learning, but you need to understand that machine learning is artificial intelligence. So these are a few of the day-to-day applications of machine learning. Maybe I'll just point a few. For example, people who are interested in watching movies, and maybe you have an account on Netflix. So if you watch a movie from actor A, after watching maybe that movie and that same actor A has a new movie, you get a notification. You receive a notification that, you know what, actor A has a new movie on board. So that is all AI. Another example, common example that we can use for everyone to understand, I'm making an assumption, but this is not even an assumption. This is reality. Everyone who has joined today's training, you have an email address. So you have an email address where you have your inbox and you have a spam folder. So when you receive an email, it passes through a machine learning model to first check, is this email spam? If it is spam, then the email is routed to your spam folder. If the email is not spam, then the email is routed to your inbox. So there are a lot of applications in the day-to-day life where machine learning is applied to fraud detection, natural language translation, image recognition. So with the interest of time, we can get to know more application of machine learning in our day-to-day life. But if you are to just focus on healthcare, like we can use AI in enhancing medical imaging. For example, the project that is going on within the 5 countries that Vicky talked about, the instance is to collect those ultrasound scans to train a machine learning model that can really support a non-technical person. If you're not a sonographer, to do a standard of care scan. So that is all machine learning. So it will be improving medical imaging and bringing services closer to the public. So these are just a list of other applications of machine learning in healthcare. So what is machine learning generally? Machine learning is all about, we need to understand the difference between the traditional programming and machine learning. So machine learning is all about allowing computers to learn and infer from data without being processed programmed. Like, for example, in the traditional programming, you take data as the input, and you have set of rules that you've predefined, that if you get some instance A, you need to take this action. That is in the traditional programming, so that you can generate an output. But in machine learning, for example, if I'm going to train a model to predict maybe a patient with breast cancer, so I will take the images, the scans for the breasts, maybe the X-rays that are done as the input. But definitely I need to label, like Martin in the presentation talked about labeled data. I need to label the data that, okay, this X-ray is of a patient with breast cancer. This the second X-ray, maybe the person has no breast cancer. So definitely I'm taking the input data with already the known outcome, and I just want to train a machine from this data so that when I come up with a program and I use that very program, which I'm calling the model, on another set of data, that model is able to identify that, you know what, based on the input image, the person has breast cancer or no cancer. So there is a very much difference between the traditional programming and machine learning. So with machine learning, let's try to understand the types of machine learning with some examples. So the common types, we have what we call supervised learning. Like Martin said, we have unsupervised learning and we have reinforcement learning. But as of recent, there has been a rise of a combination of both unsupervised and supervised learning to come up with the fourth type called semi-supervised learning. So what is supervised learning? We can further divide supervised learning into classification. For example, you're training a model to predict whether you have diabetes or no diabetes. That is classification. When we cross to the side of, let me use a pen. When we cross to the side of regression, maybe for example, I want to train a model to predict the price of a two-bedroomed house in the next 5 years. So in other words, for regression, which is a subcategory of supervised learning, you're looking at predicting a continuous variable. We are going to see some simple example for easy understanding. On the side of unsupervised learning, the commonest type is called clustering. For example, if I get hospital data and I pick an algorithm, I train it to cluster patients based on their disease. It can help me cluster out patients with diabetes in a cluster of patients with diabetes and a cluster of patients with cancer based on the data that I've got from the hospital. A simpler example could be of unsupervised, could be, we all use airtime. So usually telecom companies try to give bonuses during festive seasons. So they use an algorithm of clustering to give bonus based on the usage of airtime. If maybe you use much of your airtime to buy bundles, they increase the bonus on your bundle. If you use much of your airtime just to make physical calls, they add you more minutes on your airtime to make calls. That is clustering. So let's use layman's examples to understand supervised learning and to understand the difference when we say labeled data. For example, we have different, this is our data that we're going to take it as the input. And we are looking at this, these are different, we have a rectangle, square, a triangle, and a hexagon. So we take them as with their labels, like triangle, rectangle, circle, and we pass our input data, which is labeled with their labels. We pass it through an algorithm. And that algorithm can generate for us a model that if you have new data, which is not even labeled, that trained model can easily predict, based on what it learned during the training, it can easily predict that, you know what, based on what you've given me, this is a circle, this is a triangle. So once we say supervised learning, we are using labeled data. This is what we mean. We get the input data with labels, like circle, triangle, and we pick an algorithm, we train a model so that the next time when you get input data or test data, it can able to make prediction. So that is the meaning that with supervised learning, we have labeled data. So with a similar example to understand unsupervised learning, I have the same shapes like the previous example as my input data. But this time round, they are not labeled. I just need to get an algorithm to train a model based on this input data. And what you're seeing, we are implementing clustering. Remember, a subtype of unsupervised learning, we say clustering. We've tried to cluster, this model is trying to cluster based on, we can cluster based on the color, all greens together and all reds together, or based on the shape, all triangles together, all circles together and squares together. So with unsupervised learning, your input data is unlabeled. And the goal is to train a model to be able to identify patterns from the input data, but the data is not labeled. So when we close to reinforcement learning, I'm going to use a very simple example to understand reinforcement learning. With reinforcement learning, we always have the agent and the environment. So the agent takes an action in the environment. So based on the action taken in the environment, the agent will always receive a reward. The reward can either be positive or the reward can be negative. And definitely after receiving a reward, there will be a change of state. So I'm going to use a very simple example to understand reinforcement learning. Let me hope everyone has ever seen a baby learning how to walk. So in that example of a baby learning how to walk, the baby is the agent, okay? The baby will act as the agent, and the environment is where the baby is. So the baby will stand up and make a few steps to try to walk. Maybe the baby will make like 3 or 4 steps. So the walking is the action the baby is making. And the reward always when a baby is trying to learn to walk, or is the person with the baby or the mom, we always try to clap for the baby or to give a sweet, and that is the reward. And in that instance, that is a positive reward to encourage the baby to learn to walk. And there will be a change of state in terms of moving from one step to another. So one may ask in that example, how can we get a negative reward? The negative reward is always maybe a baby stands up and the baby fails to make maybe steps and the baby will just fall down. Definitely the mom will not clap for the baby and there will be no reward, like a positive reward. So that will mean that the baby has received the negative reward. So that is the simplest example to understand reinforcement learning. And reinforcement learning is much used in training robots. So there are some vocabularies that we need to understand once it comes to machine learning. We have 3 vocabularies that we need to understand. We have what we call a target. We have what we call features, example, and a label. So a target is a predicted category or a value. A category is what you are interested in. For example, if you have data and maybe age, hypertension, you have some data, and you have a column where it states the patient has maybe cancer or no cancer. So in that example, that will be the target. Maybe you want to train a model to predict the occurrence of cancer. So let's demonstrate with an example. So we have a column of, we have data of 5 columns, and sepal length, sepal width, petal length, and petal width, and we have a column called species. These are the different types or categories of flowers. So in machine learning, if you have your data and you identify your target, in this example, maybe you want to train a model. Once we give it an image, it can tell us this is the particular species of a flower, maybe Setosa. So in machine learning, if you have your data and you identify the target, so column species will be our target, because this is what we were trying to predict. In the medical example of predicting diabetes or cancer, column that has the status of cancer will be our target. So in machine learning, after identifying your target, the rest of the data or the rest of the columns turn out to be what we call features. So this is the very example of flowers, data about flowers. So after identifying the target, which is species, column species, the rest of the columns turn out to be what we call features. So you need to understand the difference between the target and the feature. So we also have what we call an example. An example is the entire row in your data set. Like it combines both the features and your target. We also have what we call a label. A label is just a category in your target. For example, in this example of species, Setosa is a type of flower. So it's what we call a label. So there are three major things that we need to understand about machine learning algorithm. One is representation. Representation looks at which algorithm. Okay, you have data that you're going to use to train a model, but you need to know how you're going to represent your model. So you need to care about the representation, the evaluation, which metric are we going to use for evaluation, and the third thing is optimization. Because for the first time of training, definitely the model is not going to be accurate. You need to find means of improving the model. So amongst representation, there are neural networks, there are decision trees, support vector machine, and others. But I just wanted to point out 3 key major components of machine learning algorithm. That is, you need to cater for the representation, which algorithm are you going to use? You need to cater for evaluation, how are you going to evaluate the performance of the model? And the third thing is optimization. How are you going to help the model improve? So these are some of the tool sets that you can use. Definitely, for a starter, you need to know, you need to use a notebook in writing your code. And one of the common notebook is a Jupyter notebook. You need to know some of the common libraries, like NumPy, SciPy, and Pandas for numerical computations that you're going to do. Definitely, you need to visualize your data. You need to use either Seaborn and Matplotlib. These are libraries for data visualization. And definitely, you need to look at scikit-learn, where we import all these algorithms for machine learning. So this is an image showing how Jupyter Notebook looks. There are a lot of different notebooks. There are Google Colab, but one of the common one is Jupyter Notebook. So almost concluding the introduction to machine learning. But why machine learning, or why AI in this ultrasound? So definitely on the clinical side, the expert need a lot of time in doing the examination. For example, if you need to interpret maybe 100 scans of women on a daily basis. So it's always time consuming, and definitely you need an expert to do the interpretation, and on the clinical side, we have limited access to the experts. So the solution is this AI, or what we call or machine learning, because it will support with shortening the examination time and reviewing, and also reducing the workload, and also improving on the accuracy of the examination that is done. So these are the benefits that are brought up by AI. The benefits are categorized in the healthcare provider itself, the patient, like you need less time to do your examination with the expert, and also on the healthcare system. Definitely, they'll be able to see or to do multiple scans, if just in case you're doing scans, and they'll be able to see many patients with the application of machine learning in healthcare. So this marks the end of a brief introduction to machine learning. Any questions? And maybe back to you, Victoria.
All right, thank you so much, Henry. I've just been seeing questions about the LMS. I think let's say that we are very good instructors, that the students have got no questions, or maybe because this is information they already know. So I want to put a question as before Henry presents the next on computer vision, that we can have at least like a 5-minute break before the next presentation is done. FYI, Henry, you're getting a lot of shout outs and claps right on the screen. I don't know whether you can see those. But I have one question for you. For everybody in the group. Remember, we are medics, we are computer people, we are nurses, we are radiologists, all mixed together. So I have one question. Let's see the answers. I want to hear, and this just goes along the lines that both Martin and Henry presented in. So in one sentence, describe how you think a machine could help a doctor in healthcare. Note, a machine is up to you to determine what that is and how it can help a doctor in healthcare. We are not limiting it to which healthcare area. So which way do you think this could help? So I'll just read some answers, at least for the next 3 minutes, and then we can go ahead and start off the next one. So we've got diagnostic accuracy. Yep. Thank you, Rosina. You have a very hard name. I will try and assume. Yoti. I don't know that the J is silent. Make better decisions by providing them with insights. Yes, I agree on that. We have ease of workflow by Rita. Thank you. Yes, reduced workload. Don't we all want that, especially when you're working, when you've got 5,000 tasks, you want to reduce your workload in any way possible. Yes, Emma, thank you. Nuruddin, assist in prediction of diseases like preeclampsia, gestational diabetes. Yep, thank you. Shushanta, we have analyzing large amounts of medical data. Yep, you end up with so much. Sheila says faster diagnosis. Yep, thank you. Moses, I will not try to pronounce your last name, but Moses, accuracy. Yep, thank you. Doreen, follow up with patients. Yep, agree to that. Ugu, we've got faster processes. Yep. Patricia, reduce on the doctor's work. Yes, we all want that. Stacy, know the best course of action to take in case of an emergency. Yep, if a patient comes and is bleeding everywhere, how do we deal with that? I'll take a couple more. Maurice, triaging to identify critically sick patients. Yep. Sukriti, easy prediction of disease and higher accuracy. Yep. Victor says save time, reduce occupational stress. Agreed. And then I'll just take one last one by John, where you could help a doctor analyze a patient data to detect patterns. So we have got 13 more that I haven't yet read. Please go through these. Please note, you're not all medics, neither are you all computing people, but then the responses I'm getting is actually quite amazing. So we are going to have such forums within the learning management system. The two scenarios that Martin gave already up. I will be giving a manual by the end of today on how to use the learning management system. At the same time, we also have a poll. He had given a poll, so it's also on the learning management system. I'll give you a manual on how to deal with that. All right, back to you, Henry. Our 3 minutes are up. You can begin with the next. Thank you.
All right. Maybe just please confirm that you can see my screen.
So,
Yep.
So
Yes, you can.
You're going to have still an introduction to computer. But this time around, I wanted to start with just the testing, an example. So you're going to, there is a platform called Teachable Machine, teachablemachinelearning.com. So we are going to train a simple model that can identify. I'm going to opt for an image, but you could do maybe an audio project or a posture you pose and it can identify the gesture that you're doing, but I'll opt for the one of an image. So I'll start by clicking. Definitely, we all understood that for machine learning, definitely, okay, there is a problem that we need to solve. The biggest part, first, you need to understand the problem thoroughly. So after understanding the problem, then you collect data. So maybe in this simple example, we want to build a model to identify my face. So I'll start by labeling. I'm going to collect data using my camera, and so I've immediately, a mere clicking, I've collected over 30 images that are going to be taken as an input. We also need to collect, maybe let me move around my screen and see whether I can see the window. I use, okay. I also collect some examples, some data of windows. So after collecting your data, definitely you train a model. You pick an algorithm and you start your model training. So the model is done. So the training is done, but amongst the things that maybe when it comes to the neural networks, and you need to know the number of epochs, the batch size, the learning rate, which we are going to discuss in the slide in the upcoming presentation. But now, remember, we already have our classes. One class is called Henry. So the camera is facing me, definitely. It's making a prediction 100% that the image it's seeing it's of Henry. But if I move around to the windows, so it can detect that is 100% that it's a window, it's not Henry. So that is an example of computer vision. So that is what we want to dive in. Okay, please confirm that you can see my screen.
Yes, we can.
So with computer vision, we are going to start with examples. For example, we have an image that you're seeing in the slide, but one may ask, what is computer vision? So I will start by just breaking down these two words, computer and vision. So in a layman's understanding, vision is just like if I pose a question based on the image on the slide, what do you see? So some of you are going to see, are going to tell me that we can see vehicle, cars, we can see people crossing, we can see zebra crossing, we can see a truck parked on the side, there are traffic lights, I'm seeing a flag, buildings in the background. So that is what you can see. So if you are to join back the word computer vision is just a field of artificial intelligence that trains a computer to be able to interpret and understand visual information from the world like the way humans would do. For example, if I ask you, can tell me, okay, you see people crossing. So in other words, with computer vision, we are giving a computer an eye, or we are giving a machine. And whenever we say machine, we are referring to a computer. So we are training a computer to be able to see. We are giving it an eye to tell us what it can see. Whenever it sees maybe something, it can say, I've seen Henry, I've seen a car, I've seen. So computer vision is all about giving a computer an eye. So there are a lot of different examples of applications of computer vision, from robotics, from robots that you see. Definitely robots needs a camera to see the environment, the movement, and all that. That is computer vision. From your mobile phone, you can take photos, you have a camera, computer vision. Autonomous driving, that is self-driving cars, self-driving bicycle, they require a camera that acts as an eye to see, computer vision. Once it comes to medicine, to the field of health, maybe you want to train a model to predict breast cancer, you require to take X-rays or ultrasound scans, and you train a model that whenever you use your camera, it picks and it does the computation in the background, and it makes a prediction that maybe the person has breast cancer or no cancer. That is still computer vision. So we have a lot of applications of computer vision, but in simple terms, how does computer vision work? So definitely you have the eye, which is in this example of a self-driving car, there will be cameras. They will take photos or images of the surrounding. They pass whatever they've seen into a neural network, maybe convolutional neural network, and it will make a decision for the steering wheel, either to turn left, turn right, or for the brake to stop. So that is how computer vision, and it's very key. In other words, when you give computer an eye, so it can do a lot, it can act like a human being, it can move, it can. So computer vision is much needed in the health sector. Like the examples that I gave of breast cancer, maybe skin cancer, you just take an image of someone's skin, it is passed through a trained algorithm and a model, and it can make a prediction. And you know what? You have skin cancer or you don't have skin cancer. The Google Maps that we use to predict, to tell us the alternative route that we should use, maybe this route has maybe a lot of traffic, computer vision. Like the example that I used of facial detection and recognition, computer vision. So those are some of a few of the applications or examples of computer vision. But now we need to understand the logic behind computer vision. For example, if you have this as an image, how are you going to train a computer to understand and identify that next time when you give it an image, it can identify that this image is of a human being, or the image is of a dog, okay? So for example, if I'm going to train a model, and I'm going to use maybe convolutional neural networks, we have something what we call the convolutional operation. Now we've reached at a stage on to see how are you picking the features from this image so that you train a model and the model can understand. Remember, I may say we all understand that computers do not understand words. The computers do understand numbers, the zeros and one. So we have a concept called convolution operation. The convolution operation is all about, remember, if you have an image, like the images that you're seeing, these images are in form of pixels and they are in form of numbers. You have numbers inside the images. So how do we pick important feature from an image is we need to perform what we call the convolutional operation. We're going to see an example. For example, just take an assumption that this is the original image that we are taking, and this is how the image looks. And this image is of a 5 by 5. And remember, I've said the image has pixels. So we are going to apply a filter. At a later slide, we are going to understand what is a filter. We're going to apply a filter onto this image. And also a filter has pixels. You see there are zeros and one, because the computer understands zeros and one. So we are going to apply a filter of a 3 by 3. And we perform the convolution operation. The convolution operation is all about the dot product. It's all about multiplication. So we shall get, remember, a filter is of a 3 by 3. We shall place it from the left, like the way you see it in the diagram, in the image here. It is of a 3 by 3. So we multiply the pixels in the image and the pixels in the filter. So 1 times 1 plus 1 times 0 plus 1 times 1 plus 0 times 0 plus 1 times 1. And the final answer, what we got is 4. So the result from performing the convolution operation is what we call a feature map. In other words, the convolution operation, we're trying to extract information from that image. Let me hope we are together. So convolution operation is just an element-wise multiplication of the pixels in the image and the pixels in the filter. So definitely we're just doing multiplications so that we can pick out information from that image. Let me hope we are all together. So it's all about this, all the examples that I'm showing you in these slides. They're just performing the convolution operation. And when you're doing it, after performing the convolution operation, you need to shift. You go to the next section. Now the filter will start from here. You move from left to right. Then you'll have a filter here, and you do the same thing. You perform the convolution operation, which is just dot products of pixels of the one of the image and the filter. You record it somewhere there. You do this, you shift the filter again to start from here and complete. You record the result that you get. Now you need to shift it from top to bottom. For the start, it started from here. Now it will start again from here, and you perform the convolution operation until you complete the entire image. By doing the convolution operation, you've now extracted all the important features in that image, and now they can be passed onto a computer to train it to learn, so that next time when you give it an image, it can identify that, okay, this image is of a human being or this image is of a dog. So that is the process of extracting features from an image. Okay, so we have key elements that we need to understand when we're doing that extraction, when we're picking out the important information from a given image, be it a scan, be it an X-ray. So when you get an X-ray, in an example of the medical side, you'll be given access to the scans that have been done. When you get that scan, you need to pick out you need to train a computer to identify the most important information from that scan. And definitely, you need to perform, if you've selected maybe convolution neural network, you need to perform the convolutional operation, the dot product, the multiplication. But they will be supported with what we call a kernel, or some people call it a filter, or other people call it a feature detector. So what is a kernel, or what is a filter? A kernel is nothing but a filter that is used to extract features from an image. In the example of the virtual training, you're going to be given access to scans, ultrasound scans. So definitely, you need to find means of extracting the data from those ultrasound scans. So you need to move the filter into your input data, and your input data will be a scan. Those scans, you need to move the filter on your input data as you're performing dot product with the subregions of the input data until you get what we call a feature map out of it. But there is a formula that can help you, cause always, if I'm to go back, always, for example, if I'm to apply, this is an image, my input image of a 5x5, and I'm applying a filter of a 3x3, I need to know the size of the output. So there is a formula that you can use. It is given by I meaning the input, your input size minus K representing the size of the filter plus 1. So the size of the input image is a 5. So 5 minus the size of the input filter, it is a 3. So 5 minus 3, it will be 2 plus 1. The answer will be 3. So we expect a feature map or an output of a 3x3 after performing the convolutional operation. So that is a filter. So this formula can help us to get to know the size of the output after performing the convolutional operation. So that is what we call a filter. In simple terms, a filter helps you to extract information from your input image, as you see the examples on the extreme right. So we have what we call a stride. A stride will help you to determine how your filter is moving. So a filter is moved across the image from the left to the right and top to bottom, and you'll be moving either 1 pixel column change in the vertical movement and 1 pixel row change in the vertical. Remember, we're moving vertical, you're moving from top to bottom. In the horizontal, we are moving from left to right. So if a stride is a value that tells how you're going to move your filter during the process of extracting features from your input image. So a stride is just a number, a value that is going to tell you how your feature, how your filter should be moved when you're performing the convolutional operation, or in other words, when you're extracting important information from the image. We have another concept which is called padding, and padding always is, for example, I'll just give an example to understand. You have an image, the one that I'm demonstrating using this marker. You have an image, and there is much of concentration, maybe in this corner, and some concentration in the center, and that's all. That is the image that you have. But remember, when we are performing the convolution operation, for example, you saw that some fields are given less attention, like the corners. So if I put there a filter, I perform the convolution operation and move on. Areas in the center will be given more access. In other words, you'll be able to look at them multiple times, and that will cause what we call the border effect problem. And the border effect problem can only be solved by applying what we call padding. In other words, we apply padding of 0 pixels on our image. Remember, this is going to be our input image, and we are just applying padding onto that image. So when we come to extract features from this image, maybe if I'm going to use a filter of a 2x2, I'll give attention. I'll put my filter here and perform the convolution operation, and I shift it again. I put it here. I perform the convolution operation. You will see that this area marked X is given attention like twice with padding, but without padding, you only give attention to this area just once. And with the example that I gave, I said we have much concentration of content in the corner. So I wanted to demonstrate that if you give less attention to some sections of the image, you're losing out information from that image. So we have what we call padding, and padding can help to solve the problem, which is called the border effect problem. Yeah, these are just notes that you can read. So we have another component called also pooling. Pooling is, after performing a convolution operation, you may come up with a feature map which you need to scale down. Remember, you have an image. The image is in form of pixels, and you need to pull out information from those pixels using a filter like the way we said. But after performing the convolution operation, you might need to scale down the values that you've got. So we have two common methods of pooling. We have what we call average pooling, and we have what we call max pooling. So on the extreme left, we have what we call max pooling. So if I have a filter of a 2x2, this blue area, and I'm going to perform pooling, and I'm implementing max pooling. Max pooling is all about you pick the maximum pixel. You see, amongst this area, we picked out 9. So we move our filter to the next region. We shall come here, and we are implementing max pooling. Amongst the values that you see, they picked out 7 because it is the maximum value. So that is how max pooling works. You move the filter again, you pick out the maximum. This time round, it's 8. You move the filter again. This time round, it is 6. So after performing pooling on max pooling on this image, this is the result that you get that you're getting. On the other side, we have a method called average pooling. Average pooling, like the way it sounds, you just find the average of the pixels. You just add the pixels together. In this example, if we are also using a 2x2, so we just get 2 plus 3, which is a 5, plus 5, that is a 10, plus 6, that is 16, divide by 4, and the answer will be 4. So that is the pixel that we'll pick from that area. So that is what we call max pooling. But we need to get a clear example. This is the example here. Okay, so we have our input image, which you can see here. And now this is the entire training that you're going to do using the convolutional, this example using convolutional neural networks, CNN. For example, you have that scan, ultrasound scan. They will give you access to that data. And now you're going to train maybe to predict the sex of the fetus in the image. I'm just giving an example. So you need to take that scan as the input. In this example, the scan, the input image is of a 28 by 28 by 1. The 1 is representing, this is a gray image. It's not a colored image. If it was color, if it had color, the value could be 3. So we are taking it as an input image. So we are going to perform the convolutional operation. We are using a filter of a 5 by 5. What is going to be the output? Remember our formula that we add. You get the input size which is 28. 28 minus 5, it will be 23 plus 1. So the feature map after performing the convolutional operation, it will be of a size 24 by 24. Okay. Then you perform max pooling. Remember, when you have the image, you perform a convolutional operation, as we've said. The output now becomes the input to the next stage. Now we are having a 24 by 24 image, and we are going to perform max pooling on that image. So after performing max pooling, we are getting a 12 by 12. And the 12 by 12, we perform a convolutional operation on it with a filter of a 5 by 5. So it will be 12 minus 5, which is a 7 plus 1. The output will be 8. Then we perform max pooling again of a 2 by 2. The output of it will be a 4 by 4. So we shall flatten that output and we take it to a neural network to train. And the output will be in form of probabilities, maybe numbers. For example, if maybe you're predicting, I'm just giving an example, the gender of a fetus in that scan, that's the data that you get access to. So that you'll be of probability. The one with the higher probability will be the prediction made by the model. Maybe it's 0.7 and it lies on M, which is male. So that will be the prediction made by the model. But the instance is to tell you how you move from the image, the scan that you're having, how do you extract information from that scan, and how you train the neural networks so that it can make a prediction. So in this convolutional neural network, what we call CNN, you can apply multiple number of filters every time. So in this example, we've applied 2 filters until you get to the output. So you need to, the instance of applying filters, you're just extracting important information from your input data. So this is another example. You're taking input data of images of animals. You perform a convolution operation, then max pooling, then pooling again, until you pass it through a fully connected neural network, and it makes prediction. So the prediction is 0.2, 0.7, and 0.1. Definitely, the higher probability produced, which is 0.7, will be the prediction made by the model, which is a zebra. Now, the model made the right prediction based on the input. The input was an image of a zebra. So similarly, you change the input image to maybe an X-ray, and you follow the procedure. And you do this multiple. You need to train the model multiple times in terms of, you need to specify the number of epochs, the number of batch size that you're taking as an input. But we are just painting a picture of what happens if you're given access to that data. Yeah, there are a lot of different architectures of deep learning if you're going for convolutional. But I want to point it out. I want to make it clear that if your size of the data set, I refer to the number of images that you're having, are very small, because convolutional neural network works best when the size of the data set is small, because there are always advancements that are coming in. People who are coming from a data science background, transformers. They have tried applying transformers into images. For example, the vision transformers. So you need to be keen with the size of the data set that you're going to use. If the size of the data set is small, it's better you opt for convolutional neural networks. But if the size of the data set that you're having in terms of the number of images that you're having, if the size of the data set is big, you can opt for the attentional mechanism, which is representing the vision transformers. So these are some of the architectures, deep learning architectures that you can use, and you apply Euro, which falls under CNN, UNet architecture. So these are some of the architectures that you can use in computer vision. So when we cross to techniques, things that you need to do when you get access to that data, definitely you need to do some pre-processing in terms of normalizing. You need to do feature extraction. We've seen how we can do it. There are some scenarios that may require you to do segmentation. You need to mask out most important features in your image. Maybe those are the features that indicate, maybe in a scan, that area has cancerous cells. You need to mask it out. And also you need to do pre-processing and even post-processing of your data in computer vision. So the implementation, you acquire data. This is telling you the data that you're going to be using, the images that you're going to be getting access in form of the DICOM format. You acquire data. You do annotation of the data. If you're going for supervised learning, that's why on the teams that you're having, we said we required a medical personnel. At the start, we had opted for a sonographer or a radiographer, but we let it to be open. You need a medical personnel to do the annotation of the images. You need to do model training, and you need to validate and later deploy your model. Popular CNN architectures that are used for classification, you can opt for DenseNet, ResNet, and on the side of segmentation, where you mask out important section in your images, UNet can also apply. Yeah. What are the challenges that we have in computer vision once it comes to the medical side? One of the biggest challenge in machine learning is getting a data set, it is a challenge. But in this scenario, the data set is going to be provided. But another issue on the data set is an imbalanced data set. For example, if you're going to train a model to predict cancer, you need to find means of balancing your data with cancer and no cancer to try to be a little bit balancing. And the other thing is the black box. You need to find means of interpreting what is happening and what is going on with your model. Those are some of the challenges. You need to get ethical approvals. If in real setting, you want to do you build a product that is going to be used in the hospital, you need to get ethical approvals from your countries. Issues of privacy, concerns of privacy. In this example, that's why you're going to use real data, scans that have been taken in the hospital setting. And to address the issue of privacy, we brought up a concept of federated learning. Federated learning, they will tell you, you can train a model on data in China, and the data resides in China. You have no access, but you're doing the training on that data. So we brought it up a concept of federated learning, and they will be taking you through. The other thing is generalization of the model. In most cases, in your lab or in your training, you train your model and it's working best. But once you take it for testing in a real setting, it may perform not so well. So issues of training models that are generalizable is also a concern in computer vision and in machine learning generally that you need to look at. Yeah, best practices, definitely the experts will help you, and the experts on the team, the medical people, they will help you with you may have less data and you need to replicate the data that you have. So the experts will help you, and definitely you need to look out for algorithms that can help you interpret and visualize what is taking place in during the training of your model. So future direction, and I want to conclude, we are running out of time. Definitely, emerging technologies, I've talked about federated learning, which we shall get access to it. We shall get experts to take us through federated learning, where you can train a model. You don't have data here, I'm seated here, but I don't have data, and I train a model on data in China or in a different country. Multimodality, incorporating both text and image, different versions of data, text, image, audio, and real-time inferencing. You train on data on real time to make decision. So this is just basically painting a picture of computer vision, and computer vision in medical imaging is just transforming healthcare one pixel at a time. So that marks the end of the introduction to computer vision, and I open up for questions. Back to you, Victoria.
Thank you so much, Henry. Thank you. You're getting a lot of claps. They're really enjoying this session. They're really enjoying the topic. I have got so many questions. Because we started slightly late and it's day one, we knew we would go slightly over the 2 hours we had proposed for the first day. I think we'll allow for like 15 minutes so that I can read out for Henry the questions and then he can respond to them. I'm hoping there are some of you who will be able to unmute. Perhaps Silas Okumu, are you able to unmute and ask your question about GitHub? On the other hand, I'll be reading the rest as we wait to see Silas, whether he's able to unmute. All right, so the first question, in case he's able to unmute, I will let you know. If not, I'll read his question next. So the first question is, how do we perform the convolutional operation, especially for those who are not AI oriented? That was the first question that came up.
Okay, so I respond one at a time.
Yeah, should I, or would you like me to just
Okay.
put all questions somewhere?
Okay, let me respond one at a time. So
Okay.
what you solve performing the convolution operation, picking out important features from the image, it's a line of code that you call a convolution layer onto your input data, and it pulls out the important features. But we wanted to paint a picture, or we wanted, like, definitely on your team, you have a software developer, an expert that you write code, and the code does the convolution operation, and you see the output. But we wanted to tell you what happens in the background. So in the background, yes, we have this image. We need to extract important features from the image. And how do we do it? We apply a filter onto the image and perform the convolution operation, which I said it is performing dot products of pixels between the input image and that of a filter.
All right, I hope that answers. Victor will indicate on the chat. Thank you for that. The next one is by Frank Kayemba. Do you have examples of 3D images in healthcare, and how do CNNs process 3D content? So maybe, yeah, if it's not too long, you could answer the first part. We'll do follow-up questions.
Definitely. In the data set that we are going to use, we don't have 3D images, but there are 3D images in a medical world. More so, those that are doing we have what we call geometric deep learning. And I attended a summer school in Nepal, where if you are tailored to geometric deep learning, that is, you can use 3D images of, and definitely, you're going to apply, there is a twist on how they applied geometric deep learning, and definitely you can apply it. That is a response that I can give.
All right, thank you. So the next part is how is the shape of the feature map different from input after convolution? That is by Saroj.
Sorry,
So
come again?
the shape of the feature map, how is it different from input after convolution? I know somebody responded, they said it depends on the size of the filter. Maybe you can say that that's the correct response.
Yeah, definitely. If you want the size of the image to be the same size as the output of the feature map, you apply padding. But I gave a formula. If you have a kernel, I is representing the input size of the image. If it is a 5 by 5, which means you get 5 minus the size of the filter or the kernel. In the examples, most of them we are using 3. So you get 5 minus 3 plus 1. So it will tell you the size of the output, or what we call the feature map.
All right, thank you. So I will be making sure that I have a question forum that the facilitator can access to answer additional questions, but at least we can be able to answer the ones that are here that I'd seen before. So there's a question by John. When you are looking at the filter by moving stepwise, there was the issue of if you're doing like a 3 by 3 filter, and the last 2 rows, instead of having 3, have got only maybe 3 by 2 pixels remaining. How do you handle this? How do you handle such edges that don't have the full data?
Definitely. If let's take an example. You have an image of a 5 by 5, and now you're using a filter of a 2 by 2. So either you leave it out, or the movement of the filter that is determined by the stride will tell you. Let me try to reshare my screen. Okay. Okay. So in this example, if you don't apply, if you don't apply a stride, remember stride, I said, is a value to tell you the movement of a filter, how you move the filter. But this is a 5 by 5, and we are applying a 3 by 3. So you may find you have a value of a stride which is equal to 2. Instead of moving like the way we are moving, we move from this first one. Later we move here, the filter to begin from here up to here. If you have a stride of 2, we shall skip this. Definitely, we shall come and start from here. So it will depend. One, if you have a stride, the value that tells how a filter is moving, or in the instances of pulling, you've applied some pulling, you leave out some of the pixels from the image. Back to you, Victoria.
All right, thank you. I hope that helps, John. Luanga wanted, or Claudia, wanted you to re-explain the convolutional neural network extraction process again. I don't know, I think that, was it a very long process, or can you respond that in a few sentences?
Oh, let me use,
Okay.
please confirm that you can see my screen.
Yes, we can.
Okay. So we have the input image and remember, I'm saying the image is in form of pixels.
Yes.
Okay. So we are taking it as the input, and we are saying we are applying in a kernel or a filter or a feature detector of a 5 by 5. It's going to perform the convolution operation. And the convolution operation is just dot product, that just multiplying pixels of the image and that of the filter. And in that multiplication, we are extracting important features from this image. In other words, in this example, the important feature in the image is this number, which is a 2. So you find out that the rest of the pixels, these will be zeros. And in multiplications, 0 times any number will remain 0. But you have some few pixels, numbers, that you're going to multiply and help you get this important information from this image. And best, I said, we are applying a filter. If it is a 5 by 5, remember I gave a formula. You get 28 minus 5, which is a 23, plus 1. The output will be a 24. And on that 24, we are applying pooling. And it is max pooling. When we apply it, we get a 12. We again apply a filter of a 5 by 5. You get 12 minus 5, which is a 7 plus 1. You get a 8. We apply pooling again, which is a 4. Then we flatten this and take it as an input in the neural network. If we are to go back, we have a formula of if you're applying a filter and there is a stride, this formula can also help you if you're using a stride. The stride, remember I told you, it helps you to tell you the number of movements a filter is going to, the movement of the filter. So in simple terms, in brief, that's how the convolution operation works, and that's how you extract filters and you take them for training.
All right.
Back to you,
Thank
Vicky.
you. We have 4 more questions that I will pick, no more, just because our time has really gone. This one is a very simple one from Kelvin. How small is small in terms of the size of data set?
Yeah, right. Small, we look at if you have less than 100 images, because I've ever seen there was one sub-grantee training a model from Makona Lab, and the person used only 30 images. So that is a small data set. But if you have images more than 1,000, if they are less, to me, I term it as a small data set. But if they are more, then definitely that is a bigger data set and is fit to use vision transformers. Because I told you, yes, you can use vision transform on a small data set, but it's out in terms of accuracy and performance on a small data set will be not so good compared to that of a convolutional neural network. So in terms of how big and how small, if you have images less than 1,000, that is a small data set.
All right,
Back
thank you. Thank you. Yes, I would believe, because like the project you're doing, we were wondering whether the images will be enough for you guys to practice on, and they are, especially if you were to look at the standard images, they are massive, where for each participant you're getting like 5 images. But then we're still worried whether they will be enough. All right, the other question is it possible to combine different pathways to train a model, so where it can accommodate all case scenarios? For instance, you've got different equipment, they've got different resolutions, thus different details per pixel. Is it possible to do that, or is it not encouraged?
Let me get you clearly. Is it possible to
combine different pathways to train a model so as to increase its versatility? So accommodating all case scenarios, like where you have different equipment picking the different images with different resolutions. Hence, you might end up finding you've got different details per pixel.
Yeah, definitely it's possible, but you need to be careful, and it's also possible to combine the different algorithms. Like for example, you can use CNN and Vision Transformer. Maybe you use CNN for segmenting, just pointing out areas of interest in your image or in your data set, and after getting the output, after masking, then you pass that information to Vision Transformer to do the training the model that you're working on. So it is very possible, but you need to be careful when you need to be keen when you're doing it.
All right, the last two questions. When is it appropriate to use average or max pooling? The second last question.
Yeah, in most scenarios, you saw average pooling. Max pooling. We are just taking the maximum, and average we are finding an average. So with machine learning, with AI, first of all, you need to demonstrate. In this example, you need to try out the two alternatives of using max and average, and you look at the evaluation. How is the model performing when I'm having max? How is the model performing when I'm having average pooling? Average pooling may help you just, if you have an image, for example, like the scans that you're going to use, ultrasound scans that you're going to use, almost you need to pay attention to the entire image, to the entire scan. So definitely in that use case, I recommend to use average pooling. But if concentration of the content in the image is just in one region, max pooling could be best.
Right. Thank you. This was a follow-up, but then I remembered I did not ask the first question. So let me just give you the follow-up because you'd already done that. When do you know which filter is right? The 2x2, the 3x3, or whatever feels right? It's a non-technical student. So they're just asking, how do you know which filter you should use? Like, how do you determine that?
Okay, so this brings up a concept of trying to understand what we call internal parameters or model parameters and hyperparameters. So the size of the images the size of the images will tell you. If you have a very large image, definitely you try out also a bigger size of the filter. But if the size of your input image is small, definitely, for example, if you're taking in an image of maybe a 12 by 12, you can't say I'm going to use a filter of a 10 by 10. So definitely leaving out. So the size of the filter is determined by the size of the input data. If your input image is very big, you can try to increase the size of the filter. But if it is small, definitely you need to keep it small. Let me hope I've responded to
Yes,
that.
thank you. And the final one, which was the first one, what's the importance of having a GitHub account? They are stating that they do have Google Colab, they have Jupyter from PyCharm and Jupyter from Anaconda. Which one do you advise for the training, especially as a group? That's just the last question, which was actually
The first question is having a GitHub account.
Yes, what's the importance of having a
The
GitHub account?
GitHub account is a version controller. The importance is collaboration. For example, in this scenario, their teams are maybe from one country, but we can be working on a project with you, Victoria. You push your code to GitHub, and I have access to it. I can modify. So the importance of it is just collaboration and easier mode of working on a project, which is coding, basically. Then the other question was?
So they have Google Colab, Jupyter from PyCharm, I think, Jupyter from Anaconda. Which one do you advise for the training? So
No,
Google.
every programmer, PyCharm, you can write. Basically, we need IDEs for Python. But most people use, let's get a difference by the way. If you're using Jupyter Notebook, which is from Anaconda, which means you can write your code offline when you're not connected to internet. A version of it is Google Colab. So Google Colab is a platform by Google that gives you access to a notebook and a GPU to train your model, but it requires you to be having internet. But in our settings of Uganda, internet is a problem. Internet is a problem.
That's my screen. Sorry, Henry. That's mine. Wanted to, yeah.
So internet is a problem. Definitely, you can try out to install Anaconda onto your machine, and you write your code with less access to internet. Though during the installation, you need to download Anaconda and you install so that you get access to Jupyter Notebook. But either way, it depends on the programmer. But Jupyter Notebook and Anaconda, and Google Colab, or any notebook, you're running your code cell per cell. But with PyCharm, you're going to run the entire code that you've written, and it may throw a lot of errors. And if you're beginner trying to find out the errors, you may get discouraged. But with a notebook, you run a cell. The code is either right or it throws an error, and you get to know, okay, the error is coming from this, and you work on it.
All right.
So back to
Thank
Victoria.
you so much. I know we've really gone over time. I have a feeling I'll have to be making sure I leave like 15 minutes for questions, or 30 at this point. Any other questions, we'll put them on the learning management system. That's why I'm sharing my screen. Kindly note something that I've realized. The only people with access to the learning management system are the teams that were selected for this training. So if you are, what do you call it? If you're an attendee from the secretariat side or from the technical side supporting, you might not have access to the learning management system. Hence, you might see the error that most people have been seeing. I think it's saying something about MySQL error. It's because you haven't been registered to that particular site. So send your email. Maybe we missed that you are in a team member, but then we missed your email. So just send that. I wanted just to point out, I am sending the manual, almost done with it, as well as just the email telling you how to access the account. Additionally, we have an introduction and welcome note and the overview of the course. Please do your introduction in there. Sorry, wrong forum. Where is it? It's right here at the top. It's meant to be somewhere at the top where you're meant to do an introduction of yourself. It's under week 1. Sorry about that. Please introduce yourself. It's basically for introductions and collaborations. I know these virtual forums are really good, especially if you need to do some cross-country collaboration. So please introduce yourself. I'm seeing 2 people have already done that. I'll send the manual on how to do that, but you just click on add discussion topic and then put a subject in the message. For day 1, you should have access. These are the notes by Dr. Martin. These are some of the notes, the introduction by Henry. And these are the scenarios that Dr. Martin gave. So if you click on it, again, you can add a discussion. I'm seeing a number of you have already done that. So you add a discussion topic and you say what you think about the different scenarios. We will be reviewing this. This is the poll. Remember, there was a poll about the biggest barrier in your country. Once you answer, you'll be able to see what answers people are putting in. Apart from that, we have computer vision. We've got a question here for you to answer. Again, this is a forum. Now, what I will do is here under day 1, I'll go ahead, actually not under day 1, sorry, under week 1, where you had this week 1, machine learning and medical imaging. I'm going to put in a forum called day 1 questions. And you can ask your questions there, and then the facilitators will come in and answer the questions. So day one, you will see is Introduction to ML in Healthcare and Computer Vision. So any questions you have for day one, make sure you put them there. Thank you. Martin, yes, I see your hand is raised.
So I noticed that most of the questions are coming from the technical people, and like I said, this is a field that needs joint collaboration, and that's the reason why we actually encourage you to apply as teams. Please feel free going forward to, ask your question. This is an open discussion. We are here to learn from each other. So if you're coming from a field that is not deeply technical, please make sure you don't, hold back. We are here to learn from each other. So please share those questions, use the learning platform as much as you can. And if you want to reach out, you have the emails, but I encourage us to be as open as possible. Yeah.
All right. Thank you. Thank you for that. I hope everybody has gotten that. Whether you're technical or you're in the health background of things, we want all your questions. So thank you so much. We are 30 minutes late, but nonetheless, I think this was a very good session. I would recommend tomorrow, please make sure you join at the top of the hour. So depending on where you are, these timings will vary, because exactly at the top of the hour, we will be beginning the session. Thank you, and I wish you all a good night. I will see you tomorrow as I introduce our facilitators for that day and as I do the moderation. Enjoy your evening, night, or afternoon, depending on where you are. Take care.
Take care too from Kenya.
Thank you. Take care. Bye.
Thank you.